Hi, everybody. Thanks for tuning in tonight. My name's Jeff Weisberger. I'm a Regional Associate Director of Student and University Partnerships with Ross University School of Medicine. I've been with the organization for about 4 years now, working in admissions and recruitment, but you're not here to hear about me. And so I want to turn the mic over to Dr. Jonathan Dominguez. Dr. Dominguez is one of our esteemed alumni, and he is going to just give you a little introduction about his academic pathway to medical school, through medical school, and beyond. So Dr. Dominguez, just tell us a little bit about yourself.
Yes, Jeff, thank you, and good evening to everyone who's watching. I started in Ross at May 2011. I was very excited to start at Ross, and I graduated in May 2015. And from there, I went into my residency at Hoboken University Medical School. And then from there, I was able to join a private practitioner for about a year. But soon after that, I started my own practice in January of 2020 with all the COVID stuff going on. But we've been able to grow really nicely, and we've been growing since. So I'm really excited, and my whole experience at Ross was great. So I'm ready to talk about that with you, Jeff.
Thanks so much for that introduction, Dr. Dominguez. So just to give everyone a little bit of information about how this event will go, I have some very general questions that I'm going to ask Dr. Dominguez. And having worked in recruitment for as long as I have, I know what you're curious about, not just with specificity toward Ross, but also just general questions about medical school in general, especially in what has proved to be a very unusual year. And so I think that provides a pretty good segue for me to talk to you, Dr. Dominguez, about some of these general topics. And one of them, and probably the biggest that we've been dealing with since, I guess, probably late February, early March last year, is how the pandemic has impacted the way medicine is practiced. And I just wanted to talk to you about what changes you have seen in the way that you're practicing medicine in the world of COVID. And if you could just share what changes you anticipate seeing in the medical field long-term as a result of what's transpired in 2020 and into 2021?
Yeah, of course. So like I said, I started my practice at January 2020. So by March 2020, we were a very small practice. But soon after COVID hit, I see my patients in the hospital. So I took on a lot of call. I was seeing patients in the hospital, 2 different hospitals in this area. And in North Jersey, which is where I'm from. And we got slammed pretty hard, as you know, in the tri-state area. So, from that, I was able to, our practice went to telemedicine completely for about 6 weeks. And then, of course, the more you know about a certain illness or whatever it is, whether it's medical school or anything, you adapt. And that's what we have done. We've been able to adapt. So, I would say late May, we were able to get back into the office. And we changed our whole practice, obviously, with all the social distancing, the mask wearing, and all those kind of things. We clean our office, we clean the office and the exam rooms after each patient. So we really done a lot in our practice, and I'm sure a lot of practices have done this as well. And it's really to keep everyone safe, our staff and our employees. And our patients safe. And we've grown 3 or 4-fold since then. So we've really done a lot in our personal practice, but just overall in medicine, there's so many things that, especially with this long haulers, COVID-19 patients, that we'll be seeing for a lot of time going forward. And then, the introduction of vaccines is great and all, but the virus is not going anywhere soon. So we'll be dealing with this virus for months to years to come.
Dr. Dominguez, I loved what you said about adaptability and working with prospective students and even current students. I'm often asked, what is one quality that you're looking for? What is one quality that a student should have in preparing for medical school? We always talk about adaptability in academia and beyond, because in this field, there's so much that is unpredictable. And that piece of being adaptable and being willing to change your ways in order to fit the scenario that is presented to you is just so important. And again, that's going to give me another good segue, because I want to talk to you about just preparing for medical school in general. And we'll get to the more Ross specific questions. But I know a lot of students are just curious about what advice you might have for somebody in their last year or their last years of an undergraduate program. What's some advice that you would give to them that you wish someone had given you prior to entering medical school?
Yeah, well, I mean, once you make that commitment into that you want to get into medical school and you want to become a physician, the next question is going to be, what do you want to get out of that school? And remember, this is adult learning. It's really going to be dependent on where do you see yourself for the next 4 years? What do you see yourself doing after those 4 years? And what school is going to give you that opportunity to do that? And I went through a whole a bunch of schools, and to see which one was probably the best for me. And luckily for me, Ross turned out great, and I was very happy about it. But for each person, it's different, and it really depends on the person. But like you were saying regarding the adaptability portion, yeah, that makes you not only a really good physician, a really good, in academics, but just a really good person overall. You have to change as life changes, and you have to, you can't just sit still. You have to be ready to, and everyone has kind of got forced to do that this year, I think that's going to be the way we get out of this is how we all, come together as one group.
That's great advice. And another question that I get a lot of times, and this is also related to preparing for medical school, are about clinical experiences. Do you want to talk a little bit about what kind of clinical experiences you had prior to getting into medical school, and what suggestions you might have that would prove to be the most valuable for prospective medical students to prepare for them for a career in medicine?
Yeah. So, I was born and raised in a quote unquote medical community. My parents are both pharmacists. Through them, I was able to rotate at different specialties in medicine, and then in the hospital as well. So, exposure, you can watch all the Grey's Anatomy that you want, but the exposure to real medicine and real offices and real hospital settings really will dictate where you're going to go with your endeavors in your career. And that's going to change. It'll change a couple different times. But in the end, you're going to end up doing what you like, what you love, because you want to be passionate about what you do. And essentially for myself, I've always wanted to do family medicine. And then I went through like 4 to 10 different specialties that I wanted to change into during that time. And then I decided this is what I really want to do. I've always wanted to do family medicine. I don't know why I'm keep switching and doing different things. And I've really been able to do well with it. And I love what I do, and I'm rewarded with it every day.
So one of the big questions in the last year is related to changes with the USMLE. And this is going to be such a difficult question for you to answer. It's been a difficult question for us to answer too, because you may have read that in 2023, there are going to be some changes to the Step 1 exam where it's going to switch from a numeric score into a pass-fail score. There's also, just in the last couple of weeks, we received notification that there's not going to be a USMLE Step 2 CS anymore. So really the only standardized score they're going to have is from Step 2 CK. And so a lot of students are asking us what impact people in the medical field, people in academia think that might have on students, particularly students from international medical schools, and being competitive for residency positions. So, again, like, we don't have a crystal ball. We don't know what's going to happen 2023 and beyond. But what would you say to some of those students that have concerns about how they can stand out when they get to that residency application, when they have less of those standardized scores to present to an admissions or a residency program director?
No, of course, tests are important. They've been important for multiple things, not just medicine, but throughout everyone's life. They are important to dictate if you're ready for that next step, right? And regarding to Step 1, it's such a big factor, right? Or at least historically it has been. But it's not the only factor, and it's definitely, to me, not the biggest factor, because it doesn't matter how high your STEP score is. If you're not somebody who can work well as a bedside manner, you don't have the clinical knowledge, no residency will take you. So, it doesn't really matter about the score being so high or low, although it's been historically that. To me, the pass-fail is fine, because in reality, and this is what Ross does really well, they're getting students and becoming physicians that are really, that have a personality, that have grinded, that have, had that adaptability. They've been able to persevere. And those things become important when you're talking to residency programs. You know, I would, you know, and I've told this to students before. Yet year 3 and year 4 of your rotations is one big interview season. That's where you're really showing what you're worth, and you're really showing, you know, if that's what you want to do, let's just say family medicine or surgery, that's where you're showing the person you are. You know, the test scores, yeah, you'd have to pass them, of course, right? But in the same sense, the scores don't really matter that much, at least not in my opinion.
Yeah, that's a really interesting point that you brought up. You know, you talked about it in terms like perseverance. And I've sat in on a lot of admissions committee meetings, and they like to use the word grit. And when they're looking at applicants, they know the type of students that we're known for having, and that come from Ross and go out into the field, and they have these amazing stories where, you know, they're so highly motivated, and they're such hard workers, but just because of something like, you know, one bad year in undergrad and their GPA got brought down a little bit, maybe not the best test taker during undergrad, or not knowing how to prepare really well for some of those big exams and didn't do as well on the MCAT. And those students with the chip on their shoulder come in and really kind of prove everybody wrong. And I think you really hit the nail on the head. There's an indistinguishable quality there, you know, with our students. And if they can get themselves in front of a residency program director, they'd be crazy not to take them, because, you know, they really put forth that effort. And when you look at our residency match list, and you look at where our students are practicing, what areas of medicine, and geographically where, I mean, we're so widespread, and have such a robust alumni network. And I think that perseverance, that grit is a really big part of it, because the people out in the medical field want to work with our graduates. They know what kind of ethic they bring to the table.
Yeah, no, and honestly, for, you know, I've worked in a residency program. I was part of a residency program that I was a chief resident at, and we've had residents from from American schools and from Ross, and you know, there's no stereotypes, right? But to me, you can see the difference, right? And you can see that the Ross students really, they, you know, even though they maybe have not wanted to do family medicine, they were committed 100%, because that's what they were doing at that time. And they were there 100% during that time. Whereas the other students kind of had something already planned for them. So whether they were interested in surgery or whatever the case may be, they didn't really focus on family medicine, and they really didn't give it a chance. So it's, you know, to me, I think if you're going to do something, you can do it 100%. And Ross students have always done that. And that's why I'm very proud. And, you know, it's actually, I didn't mention this earlier. My brother is actually a student at Ross right now, and he's going through that USMLE Step 1. So, you know, I am familiar with all these changes going on because of that. If not, I probably wouldn't have realized. But because that he's going through that, I'm able to know that these things are changing. And I also know that, honestly, you know, I think it's for the better, but we'll see.
So, Dr. Dominguez, we've talked about some of those pressing questions that students have before they even decide to go to medical school. And now I'd like to talk to you about that first semester, transitioning into medical school. I think that it's generally pretty well known that the first semester, or at least the first year, is one of the most difficult to get through, because no matter how much you prepare for it, there's no preparing for it. I mean, that rigor that changes between an undergrad program or even a graduate or post-bac program, and moving that into a graduate level program in medicine is just so hard to predict what that's going to look like. But just wanted to hear from you, if you can time travel back to your first year in medical school, what would you say are some things that you saw in yourself and in others in your class that are representative of habits of highly successful students?
Yeah, so you know, when I started was in, you know, Ross was at Dominica, right? So and that was back in 2011. So of course, big change, environmental change, academic change, absolutely. But I was ready for that change. I told myself I was ready to accept failure, right? So I wasn't scared to fail. Because I said, I'm going to go 100%. And I did. And I didn't, obviously I didn't fail. I did very well my first semester. But you just go in and you just go 100% in. And honestly, for the people that did well, I think that they just focused. They said, this is what I'm going to do. I'm going to give it my all. And that's all I can do. Because in the end of it, if you stress out about different things that, oh, I could have done this, or I have so much to do, medical school, you're constantly learning. You're never going to know everything. And even to this day, that I'm 9 years out of my first semester or whatever, you're still learning. I'm still learning. So you'll never, once you get past that point that you can't know everything, then I think, you start realizing, all right, these are the things I need to focus on. And then you just take it, and you can't think about all the tests at one time. If you think about each shelf exam and each mini exam and each final exam, you'll go crazy. You just have to take it one day at a time, and you go through it. And if you take it that way, you're not going to be super stressed. You'll maintain a balance in your life. I did a couple things at Ross that allowed me to have that balance. So you're not just doing all medicine all the time. You do have a life as well.
So, Dr. Dominguez, I just want to pause for just a quick second and just let everybody that is watching on Facebook Live know that if you do have any questions for Dr. Dominguez, we would like to get to any of those. So if you have any questions that are specific to his experience or just the experience of a medical student, please feel free to comment those, and we'll try to get to those at the end. Dr. Dominguez, I want to get into some more Ross specific topics. I know that there are going to be a lot of people listening in here that are considering applying to Ross. And so some things that are asked of our admissions and student university partnerships staff that are specific to the schools. A big part of that comes back to, and I'm sure you've heard this before, the quote unquote stigma of the Caribbean medical school.
Sure.
And you know what I'm talking about. I'm sure the people in the audience know what that means as well. I guess I would just want you to share like how you would describe the experience of going through clinical rotations and applying to residency as an international medical graduate, and just to speak a little bit to that quote unquote stigma.
Yeah, I mean, Ross has been around for a while now, and they graduate so many physicians yearly. So this quote unquote stigma of Caribbean schools, and obviously Ross is not the only Caribbean school, I think it's actually changing. There's, a lot of the doctors that I work with are from Caribbean schools. So, and I'm in an urban North Jersey area. So, this is, to me, that stigma used to be a thing. To me, it's not a thing anymore. For my residency interviews, I had to not take interviews because I was getting too many. I got 25 to 30 interviews just for residency. In my clinical rotations, I was offered, unmatched spots, which was a thing back then. It wasn't that you can without matching. So, obviously I didn't take those spots at that time, but to me, that stigma has come and gone. There are much more physicians that are Caribbean, that came from the Caribbean medical schools, more than ever. And I think that, the culture has continued, which I'm happy about, which is something that, I was frankly concerned, because when you come out of a school, you want to make sure those people that are coming out of that school kind of have the same mindset as you. And all the students that come out of Ross have always had that similar mindset. Of course, nothing is 100%, right? But I'm very proud of where I came from. And I say it all the time. I tell everyone that I possibly can that if they're going into medical school, to consider Ross. So I'm super excited to be part of this again. But yeah, I think that's not a stigma anymore.
I think there will be a lot of comfort in hearing you say that from the people listening, and it's definitely a big question that comes up. And you told me before we started this that you've sat in on an alumni panel before, and I'm sure you've fielded that question in the past.
Yeah.
But I think I say a lot of those same kind of things, and having not experienced it myself, I'm using the experiences that I've heard from so many alum so far, but I don't feel like I've ever actually heard one say, yeah, I really felt like I was treated differently, or that I had less opportunity. And I've sat in on a lot of these and hosted a lot of these types of events, and never once has somebody said, yeah, that stigma is definitely real. We really faced a lot of roadblocks because of that. So I know that it's always encouraging to hear from somebody that's actually gone through it. So another question is just going to be about the adjustment to island life. This is a new place. Now, I know you went to Dominica. Yeah. Our students now are going to Barbados, which, I mean, there might be part of that you're a little jealous of, because it's a little bit easier to get to. You don't have to fly on Leon. Yeah. but also I think that there's something that's not replicated there, which is like that true magic of Dominica. I was fortunate. Yeah. When I first came into the organization, one of my first weeks here, I went down and spent some time down with Dr. G, and he gave me the tour of the campus, and I got to sit in on some of the classes there. But just in general, and you can talk from your experience, and perhaps even if you have any experiences from your brother to share, but just about transitioning to an unfamiliar place. What was it like transitioning to island life? What was different for you about that?
Absolutely. So yeah, I did, I was able to go to Barbados when my brother went into his first semester, to quote unquote move him in. So I was able to see the Barbados campus, and yes, absolutely, it's much better than the Dominica experience. And then when I say much better, I'm just saying it's much more Americanized. You definitely have your restaurants and all those kind of things, the malls and things of that nature. Dominica was more of a virgin island. It doesn't matter, right? An island is an island. You're away from your family. You're away from the people you know. So it doesn't really matter. But yes, Barbados to me is creme of the creme island. It's really a nice island. But, changing to that island life is not easy, at least initially. I would say after 2 weeks, you're probably done with it, because then you make your own friends down there, and you have your own life. And now it's not just a vacation. Now it's something that you're actually part of, or you're part of that culture. So yeah, I would say the first 2 weeks, it's probably difficult to adjust to. And of course, it can take a little bit longer to adjust to, but once you start making friends down there, and everyone's doing the same thing, everyone's studying the same way that you're studying. So to me, it's the ideal place to go and study medicine. You're not at home where, your friends are, one's an accountant and one's a lawyer, and they're all doing different things. One's work. Your friends, when you go to Barbados, they're all doing the same thing. They're all studying for the same exam. So you can really focus on what you need to focus on, and excel. And, you won't have any excuses, essentially. You'll be able to really commit to your craft, and that will go a long way.
So I'm going to get in trouble with the academic advisors that I work with on undergrad campuses if I don't ask you this next question, because this is what's most important to them, and for good reason. And we have a great answer to this because we have great student support services in place. But that's one of those frequent questions that I don't always get from students, but I definitely get from academic advisors. What are some of the resources, the academic support services that are not just available, but that you found really valuable during your foundational medicine courses, and then beyond? What kind of support did you feel like you got during clinical rotations, just from the people at Ross?
Yeah, I mean, it came in multiple forms. I mean, we had a mentorship, we had ambassadors. Those things really do help. We had a tutor program. Every Wednesday night I was at and when we was a tutor, it was somebody like a higher semester. So somebody who was recently part of your semester, going through the things that you were going through, really tutoring you and giving you high yield stuff. So, those kind of things go a long way, and you make relationships that way as well. So just academic wise, absolutely, in the foundational medicine part of it, it was always someone that you can bounce off ideas. And, the good thing about Ross, it wasn't a quote unquote, cutthroat kind of environment. Everyone really was trying to help everyone, pass, and everyone was trying to help everyone excel what they needed. So, and the best form of learning is teaching. So if you can teach somebody something, you can really show that you know that topic. So that was something that we used time and time again, and a lot of group study, and things of that nature. But like I said, and again, I can talk to about it from when I was there, and like I say now, my brother has, as a group study, he's going the same rigmarole that I went through. even though it's a different campus and it's a nicer campus, and now it's remote, so it's a little bit different. But he's still part of that group study. Again, not cutthroat. Everyone's trying to help everyone to really excel and pass, and that's definitely different in other universities.
Let's talk student involvement. It's obviously a different, as we mentioned, academic rigor when you're in medical school. So the amount of time that you're going to have outside class, it's not like undergrad where you could get involved in a bunch of social organizations and a lot of clubs and also, work 35 hours a week or something like that. It's intense, but we do encourage students to get involved with clubs and organizations. So do you want to just talk about your experience, maybe even share a little bit about your brother's experience in getting involved in student organizations and just campus involvement in general?
Yeah, I mean, I think, like I said, I think it's super important to have a balance. You're studying 12 hours a day, 6 to 7 days a week. There's no movies or anything like that to go to. Of course, there's a lot of things streaming, but, you really want to socialize. You want to be able to me, integrate yourself into the community. It's something that we were able to do in Dominica. I started up a foundation, essentially, that we played the DuBlanc soccer team, which is one of the communities there. And we did a huge fundraiser event every semester. And so we had the Ross students who played soccer against the DuBlanc locals. And we just, a big, all the buses would go out, kind of like like a football game for any other campus, right? Obviously not for med school, but it was for any other campus. And it was huge success. And we really raised money for the locals there. That was one of many foundations that we were part of, and many, we were part of a Ross blood donors group, OLAS, which is basically the Latin American students. So, there's a lot of things that you can get yourself into, and I recommend it 100%, because I know, especially, for me as well, right? That first semester, you don't know what your time commitment is going to be. But I can tell you from experience, and everyone will tell you from experience, that you need to make that time. You need to make that time for yourself that is separate from academia and really from studying throughout the whole day. You want to be able to integrate yourself and enjoy the island. I love Dominica. I will go there again eventually. I wish, I would love to go there soon. Obviously COVID is different, but I ended up loving Dominica, and you should love where you studied your medicine. You're only going to be there for a certain amount of time. So instead of thinking of it as like, it's 16 months to 2 years or whatever the case may be, you should probably start thinking, I only have 16 months left, or I only have 6 months left on this island. I mean, how many people can say, oh, I get to study in an island for 2 years? I mean, I'm sure now in North Jersey, with all the 18 inches of snow we got, there a lot of people will sign up for that.
Yeah, I hear you on that. I'm looking out my window in central Ohio, and we've got a fresh coat of snow out there. It's funny because a lot of times I'll be going around the Midwest and I'm talking about Ross, and I feel like I've got like 10% more engagement in January, February, November, December, when they hear me talking about Barbados and showing pictures of palm trees when out the window it's like 20 degrees.
Yeah. Where do I sign?
So just one last question on the Ross side. And again, this is just from my experience. A lot of students want to know this. We talked about the USMLE, and everybody knows how important that is. Well, I guess maybe not everybody knows, but anybody that's really serious about looking at medical school knows that the medical licensing exam is going to be something that's so important for your future success in medicine. And so we talked about some changes that are happening, but I think that if we kind of step back from some of the changes, I would just want you to talk about your experiences preparing for the USMLE, particularly the step one, and what resources you felt like the school provided to get you ready for that. Because the students that are coming in, they want to know they're going to be really well prepared. They want to know what is contributing to that like 96% first time pass rate. And so just in your experience, your brother's experience, you said he's, I think, studying for step one right now or somewhere around there. So just talk a little bit about that.
Yeah, that's day one. Day one, they start you with preparing you for that step exam. It's so important, right? It's obviously important for the student. It's important for the university. It's important to everyone involved. So yes, they jump on that ASAP. All the the questions, the way that you have to look into your studying habits, and how do you study, and how should you look up the questions, how you read into those questions. That's really the most important thing that you can come when you come out of that first 2 years of your foundational medicine, is a step one. So that starts from day one, and I know that it continues even now, because my brother, as I told you, he's he's sitting for his step one in March. He's taking a whole bunch of practice exams. Ross has offered tutoring services. All the questions that they've been getting have been USMLE type questions. All high yield stuff. So that stuff has continued time and time again for Ross, and I think they get better and better at it every year. When I joined, they had a high pass rate for USMLE Step 1, and as we all know, that's the common denominator for American students and for Caribbean students. Everyone's taking the same test, so there's no reason why anyone is less than the other. So again, I think that if anything, the Caribbean schools, Ross specifically, that I can talk about, is going to prepare you better for step one than any other school in America.
So, Dr. Dominguez, I just have one last question for you, and thanks so much for being part of this broadcast, and thanks to everybody out on Facebook Live for joining. It's always a pleasure to participate in events like this. I'm always honored to connect with our alumni. Just wanted to see if you had any last pieces of advice for those students that are thinking about applying to medical school. And I ask that more specifically now than I might have before, just because I know right now there are a lot of students out there that are discouraged. They're going through their junior and senior year, doing a lot of remote learning. Maybe to a certain degree questioning whether they want to even go to grad school. And so just in this unusual world and in this unusual year, which we hope isn't going to turn into 2 years, do you have any lasting pieces of advice for those students considering applying to medical school?
Like I tell anybody that wants to do medicine or anything in life, honestly, if you're passionate about it, go and do it. There's no reason why you can't do it. Yes, you may have to take a different road. Yes, it may take longer, whatever the case may be. But if you're interested in medicine and you think that's going to be something that you want to do for the rest of your life, then do it and go for it. And I think, stop thinking that you can't do it, or stop finding excuses that, oh, maybe I shouldn't do it this year because of COVID, or maybe just do it, because every time you're wasting a little bit more time that you could have, already finished your first semester or your second semester, So as soon as you're academically ready to do it, and you have to just kind of pull the trigger to do it, then just do it. And what's the worst that can happen? In reality, what are we talking about? The worst to me, the worst thing that can happen is that you don't do it and you regret it for the rest of your life. I'm very fortunate to do what I do. I'm fortunate that I was able to go through Ross to allow me to have my career, allow me to have a great life that I have now with my wife and my child that I'm having in a couple of months, my firstborn. So, because of Ross, I'm able to do these things, and I'll, there's never a way that I can repay them more than they've done for me. So, definitely go for it.
Dr. Dominguez, I can't speak for everybody out there, but I think I can say pretty confidently that everybody that was able to attend tonight really benefited from hearing about your experiences. One of the things that I always say when I'm talking to students and advisors and just other people in the academic world is I love working in admissions and recruitment. I think people can tell that from the first moment that they meet me. But at the end of all of this, this is my job. I work in admissions and recruitment. There's nothing more valuable than hearing about the experiences of the people that actually went through it. And I just really appreciate you sharing all of that with us tonight. Thank you so much.
No, absolutely. Thank you, Jeff. And, anything that I can do going forward for you guys and for Ross and for those prospective students, I'm open and willing.
We got you on recording saying that, so we might have to do it. All right, everybody. Thanks so much for tuning in on Facebook Live. Hope you enjoyed this event. We have some other great events coming up. You can check those on our website. Follow us on social media. Have a great night.